Hello, and welcome to this episode of Registered Nurses in Primary Care. I'm your host, Emily Patton. We are privileged to have Dr. Maria Shirey and Dr. Erica Arnold with us today. Dr. Shirey is the Associate Dean for Clinical and Global Partnerships, and Jane H. Brock, Florence Nightingale Endowed Professor in Nursing at UAB School of Nursing. She is also the Principal Investigator for the UAB School of Nursing HRSA grant titled Building a Resilient Primary Care Registered Nurse Workforce for Chronic Disease Prevention and Control in Alabama. Also with us is Dr. Arnold, who is a clinical nurse leader and supervisor of case management at UAB Hospital. Welcome, Dr. Shirey and Dr. Arnold. Today we will be talking about transitional care coordination in primary care. So can you tell me what exactly is transitional care?
Well, transitional care, by definition, refers to coordination and continuity of healthcare that happens across transitions in care. That might be when a patient is moved from one level of care to the other, for example, being transferred from an intensive care unit to a patient room in the hospital, and then perhaps being discharged to the home. And it really talks about certain points of care where patients are very vulnerable, and that is during transitions. And the reason for that is that at that point in time, communication may break down, and there may be important information that's not shared with the new caregiver where the patient is going. And as a result of that, we risk having adverse outcomes of care. So we in the healthcare profession are very tuned in to transitions of care, and that is why transitional care is so important for registered nurses in primary care.
Do you have anything to add to that, Dr. Arnold?
Well, I would just say transitional care, like Dr. Shirey said, is across and between the transitions. So like you said, it can be hospital to home or clinic to the hospital. We see that often, but it also includes all of the services that they get. So it could be the phone calls. So there's a lot that goes into transitional care as the patient's moving to enhance that communication.
Absolutely.
Okay. So why is transitional care essential in primary care?
It's essential because communication is key. As I had mentioned previously, when patients move from one level of care to the other, there's pieces of information that the individual or the team that has been caring for that patient has that the new recipient and person in charge of care doesn't know. And so that communication becomes key, because with that flow of information also comes follow-up. What do I need to do next for this patient? What resources must I connect this patient to? What can I do, or what can we do as a team, really, to facilitate self-care management in individuals that really require that help to enhance their self-care?
And a lot of times, unfortunately, I think it's even more important for the primary care to be involved, because they're kind of the expert on the patient at their baseline. And so we have to be sure we include them. And a lot of times they're the last to know that a patient was admitted or had an adverse event that led to a hospitalization. And they're going to be your key to keeping them from being rehospitalized. So it's increasing patient safety and helping us control cost at the same time, but making sure the patient has that best outcome by the team that really knows them the best.
Gotcha.
Absolutely.
So you work in case management at UAB Hospital. Can you tell us a little bit about how transitional care comes into play in that kind of department in the hospital?
Sure. So that is our key focus that starts on admission. We're trying to figure out, again, who is the PCP, who's the team that's been caring for them. We're trying to ensure those handoffs, those warm handoffs as we call it. We want to be communicating among the teams. Like Dr. Shirey said, we know communication is key, and it's at the times of transition where a lot of the information is lost, and deciding what's important to share and what's not at the time. And so really we look to our case management team to be that continuity of care, because while the doctors change, the nurses change, the floors change, as the patient transitions, they're the continuity. They're there with the patient through the whole stay, because they cover by service. So they see the patient along the whole continuum through the inpatient inpatient stay, and then they're the ones who connects the patients to their outside resources. So they're setting up all the home care or the care that goes into the facility. So they're really that really centerpiece.
Gotcha. Okay.
And it's really important in those care transitions that patients and families are as equipped as possible, because they are the ones who have experienced that care, and they can better speak up and be able to say, oh, by the way, you forgot this piece of information that the patient knows because they've had that experience. And so it's backup systems to ensure that we're able to provide the most coordinated care that provides a continuity to facilitate the positive health outcomes that we really want for our patient populations.
That makes sense. So what is the role of the primary care RN specifically as part of an interprofessional team in terms of this transitional care that we're talking about?
So Dr. Arnold has had wonderful experience in doing this work. I'm going to let her take that one.
Okay. So like Dr. Showery said earlier, self-management is the key. That's really what the goal is when the patient returns to that community and home setting, which is where your primary care setting is in general. So it's that education. And nurses are the best trained and most equipped to provide that education to the patient and the family and the caregivers. I think key in it is going to be medication reconciliation. I think anytime there's a transition of care, there's a lot of changes that have occurred. So in my experience, I found it very important to make sure I was providing education, symptom identification and management of those symptoms, early detection. So the nurse is key in being able to catch those early signs and lead that team and communicate with the interdisciplinary team about anything that may need to happen next. And so kind of just being a true leader of the team and making sure everyone's in the loop, so to speak.
Sure. Okay. Do either of you have any additional information or resources or anything else you'd like to share about this topic?
I do want to add one thing, and that is then that when the registered nurse in primary care is working as part of a team, it's crucial that they understand the roles and responsibilities of every member of that team. Because when you have that information, you can maximize the performance of the team. And that is where we can facilitate better outcomes, when we can ensure that we're providing quality of care that is effective, that's efficient, that's patient-centered, that is timely and appropriate. You know the old saying, two heads are better than one?
Sure.
That's the beauty of an interprofessional team, because working together, we can facilitate better outcomes for our patients. So I wanted to make sure to bring up that piece of information, and that's an area that Dr. Arnold and I are very passionate about, because we've collaborated on a number of projects really focusing on that. In terms of resources, I would refer members of our audience to really tap into the additional reference list that's being provided at the end of this program, and we'll try and share helpful reading material that our colleagues can use in their practice.
Great. Well, thank you both so much for joining us today, and thank you to those of you who have tuned in. This has been very enlightening. We hope that you join us for our next episode of Registered Nurses in Primary Care.